Until now, amputation of the legs in Kyrgyzstan in patients with diabetes mellitus was almost a mandatory procedure, especially when it comes to the appearance of symptoms of the so-called diabetic foot. At the same time, of course, there are many areas of medicine, such as orthopedics, endocrinology, surgery, but they do not have time to work separately with the legs. The lack of time to deal with these issues by specialists narrowly led to sad consequences. As a result, the country was losing its able-bodied population, receiving disabled people in return. And this, frankly speaking, is an additional burden on the economy of the state, which is already experiencing not the best of times in the conditions of modern challenges. But there is a solution to the problem. With the development of medicine and the approach to treatment, a new branch in this science has appeared, and it is called podiatry. Translated from Greek, podiatry means foot treatment. And the first one who took up the development of this direction in Kyrgyzstan, Dr.Maksat. It was he who first initiated the idea to develop methods in the republic that can not only save limbs from amputation, but also give those who find themselves in a difficult life situation a chance for a new life. Having gained invaluable knowledge abroad, Bubkov not only saved hundreds of people from being crippled, but also successfully educated a new generation of personnel necessary for the country. So, for example, with the light hand of the podiatry guru, a domed clinic was opened in Bishkek, the staff of which is 24/7 fighting for every limb and finger affected by diabetes. And I must say that the students surpassed their teacher. After all, the medical institution has gathered around itself both those who know a lot about saving limbs, and those who help prevent the disease and deal with it after the fact.
Initially, the clinic was engaged only in the treatment of diabetic foot. Subsequently, due to the fact that our team has expanded, we have specialists who can also do skin plasty. We began to take patients with any chronic ulcers now. At this time, we are also treating chronic assimilitis, that is, even bone grafting is now being carried out. In principle, we are expanding. I think it is very important for our country, given that previously the only way out for such patients in treatment was amputation, or simply refusal of treatment.
As for the material and technical equipment of the clinic, then you can only envy. There is no need to list them, but there is everything that helps doctors to work miracles literally before our eyes. In addition to the treatment of diabetic foot, other unique operations are carried out in Podomed. Moreover, their peculiarity is confirmed by experts in the field of medicine. One of them, surprisingly, became a patient of the clinic himself. This is an expert of the Department of Hospital Surgery of the Kyrgyz State Medical Academy Duyashinby Sargov. He ironically noted that the disease not only comes without knocking, but also do not look at the profession of the patient. Even if you are a doctor yourself, this factor is quite indifferent to ailments, he jokes.
In the near future, he plans to perform an alloplasty on me. Alloplasty is technically simple, but the most important thing is to prepare for this operation. And after the operation, temporarily give restrictions so that the load is not on the heel area. That is, I specially prepared crutches here. If necessary, I will use them temporarily on crutches or on a wheelchair. I hope I, like you, will walk and enjoy life. There are a lot of diabetic foot sufferers in Kyrgyzstan. Not only in Kyrgyzstan, but in Central Asia. They all need specialized pediatric care. Therefore, this is a question of today, an urgent question of today. Such a clinic is needed. We need support at the state level. If God gives with the help of gladiators, the suffering will decrease and these patients will recover faster.
Unfortunately, Central Asia is lagging behind. But we are the only ones who initially started the direction of diabetic foot, and we are trying. We have even already created an association for diabetic foot in Kyrgyzstan, where there are various specialists of vascular surgeons, endocrinologists, surgeons. The goal of the association is to attract international donors, as it is the treatment of diabetic foot that requires very enormous financial costs and, unfortunately, at the moment, since this direction is not in Kyrgyzstan, the amount that is spent on the treatment of diabetic foot is very huge. It would be better for the population if medicines and supplies were purchased from international donors. I think it will be a good help for our population from our side for timely and professional medical care.
In general, almost 90% of amputation cases can be prevented if it were not for the negligent attitude of the patients to their own health, experts say. According to them, some have been self-medicating for years, while others, for unknown reasons, refrain from going to the doctor at all. So it turns out that everything ends very sadly in the end. And only a small number of people still do not have information that there have long been competent specialists in Kyrgyzstan who can help people save their limbs. Specialists between the state. There, to be honest, it is about the same as in the Union of State. There is a completely different attitude here, there are completely different devices, there is a completely different treatment. Everything is done here conditions for us. There, for example, firstly, there are a lot of people in the ward and the treatment is completely different. There is a very good treatment here. All the medicine, everything we get, is walking, everything is very good. And the specialists are very polite, because this is their prestige. And they honestly fulfill their duty, as they say. The medical staff, the nurses are all very. The food is also good. Everything is dietary, everything is fine. If you don't fall in love with your job, then it's better not to take it. This is the motto of Dr.Maksat Bubkov. He taught this doctrine to his followers as well. That is the secret of the success of his team and the Podomed clinic. Making daily rounds of patients, Maksat Kubanovich not only keeps his finger on the pulse, but also has the opportunity to just talk to everyone about different things. And such an approach to business is welcomed by his wards. According to the conducted research, after the removal of limbs, 30% of amputees do not live even a year. In the next 5 years, high mortality is observed, where only half of all those who underwent forced surgery can survive by overcoming deep stress. Why is this happening? The answer is simple. When a person loses a limb, he automatically puts an end to himself on a psychological level, feeling useless, and hurries to complete his torments. To avoid inviting a surgeon to his table, specialists give simple tips. As a rule, those who are already considered hopeless in terms of limb rescue get on the operating table. You just wonder how people endure to the last. As a result, we observe a variety of neglected forms, and here the amputation of limbs remains the only and correct solution. Do you think we enjoy doing this? Yes, I am a surgeon, but first of all I am a human being, and therefore I would like to see patients healthy and unharmed. And what should I do for this? Just contact the doctors in time, do not neglect their advice. And no amateur activity, and everything will be fine with you. And so people are to blame for choosing such a bitter fate for themselves. And it's sad. For example, this patient was admitted to the clinic for the second time. And all because of non-compliance with the regime and the advice given to him by doctors at the time. This is a clear example of how sometimes people just condone serious things, and especially if it concerns the actual health. It's my own fault that I didn't heed the doctor's advice in time. I am even ashamed to some extent that I took so much time and effort from doctors, although I could take the topic of diabetes quite seriously. Now, what could have been saved yesterday, I lost because of my own free thinking. The lesson has been mastered, and, taking this opportunity, I would urge people not to be negligent of the advice of doctors and to take measures in time so that the embryos can still deliver a preventive blow to the disease. The essence of this film is three things. The first is to inform the population that the time when people were forced to part with limbs due to the fact that Kyrgyzstan simply did not have a system to combat diabetic foot in the past. That there is a team and a clinic that will not leave you in trouble and will fight you to the end. The second is to show everyone with concrete examples what happens to those who neglect their own health. And third, we must all remember and in no case forget about the unspoken commandment that any delay is like death.